Do you have a chronic disease? Are you worried about overworking yourself and worsening your condition? If so, this video is for you. We'll explore the important topic about overwork related to chronic disease and provide tips on how to manage your work-life balance. Watch to learn more. Recognizing the signs of overwork-related disease is an essential part of keeping healthy. Common symptoms include fatigue, insomnia, anxiety, and depression. It is important to be aware of these signs so that you can take steps to address the problem before it becomes more serious. An early diagnosis can help to reduce the risk of long-term health consequences, including mental disorders and cardiovascular diseases. Additionally, it is important to be aware of how working long hours can increase stress levels, which can have serious implications on one's physical and mental well-being. In addition to the physical effects of overwork, such as fatigue and an increased risk of cardiovascular disease, the psychological and biological effects must also be considered. Research suggests that long hours and psychologically demanding jobs can lead to burnout, which in turn can cause a range of physical health problems. Furthermore, cognitive behavioral therapies have been found to be effective in helping individuals return to work and reduce sick leave. Finally, coaching has been found to be beneficial for individuals dealing with the chronic exhaustion associated with overwork. It is clear that overworking can have a serious impact on a person's physical and mental health, so it is important to be aware of these risks in order to reduce working hours and maintain good health. The impact of overworking on mental health is well documented. Studies have shown that long working hours can lead to depression, anxiety, and other psychological issues. The WHO considers depression the leading cause of disability and burnout an occupational phenomenon defined by chronic workplace stress. A work culture that encourages or demands overworking can create a downward spiral of feeling drained and overwhelmed, which can lead to decreased job performance, cynicism, exhaustion, and boredom. It is important for people to be aware of the effects of overworking on their mental health so they can identify strategies to combat any negative emotions or health problems it may cause. The relationship between overworking and low socioeconomic status is an important factor to consider when examining the link between overworking and chronic health problems. Studies have shown that those in lower socioeconomic status groups are more likely to experience adverse health effects due to long working hours, such as strokes and type 2 diabetes. Women are particularly at risk due to the differences in the social roles and socioeconomic status of different gender groups. Alarmingly, research has also found that those who work more than 54 hours a week are at major risk of dying from overwork-related illnesses. It is essential to raise awareness of the dangers of overworking, particularly in regards to individuals with low socioeconomic status, in order to reduce working hours and improve overall health outcomes for all. Examining the link between overworking and chronic health problems is an important aspect of understanding the risks associated with long working hours. Studies have shown that overworking can lead to an increased risk of cardiovascular diseases, as well as a range of psychological and biological effects such as stress, poor work-life balance, and a weakened immune system. Furthermore, those with low socioeconomic status are more likely to experience negative health outcomes due to overworking. Therefore, it is essential for patients to be aware of the dangers associated with long working hours and develop strategies to combat any potential overwork-related disorders. The connection between overworking and cardiovascular diseases is increasingly becoming a pressing issue, with studies showing that long working hours are recognized as a risk factor for cerebrovascular and cardiovascular diseases, CCVD. Scientists have also associated overworking with other potentially life-threatening conditions, such as stroke. The InterHeart study revealed that work-related stress was associated with a twice as high risk of coronary heart disease. In addition, a growing number of people around the world are dying from heart disease and stroke because of overworking. These risks are higher for those in lower socioeconomic positions, who may be more likely to face stressors due to their job. It is important to understand the psychological and biological effects of overworking in order to develop strategies to reduce the risk of developing chronic health problems. Developing an awareness of how overworking affects the immune system is key to understanding the damaging consequences of chronic stress. Studies have shown that short-term stress can boost the immune system, but when stress is chronic, it can have a major detrimental effect. This has been linked to an increased risk of cardiovascular diseases, musculoskeletal conditions, type 2 diabetes, strokes, and other health issues. Furthermore, overworking can lead to muscle tension and atrophy, as well as a weakened immune system. Job burnout can also impact both physical and mental health. It is important to monitor any symptoms and contact a healthcare provider if they persist, as they can also be related to other conditions such as depression. Therefore, raising awareness to reduce working hours is essential in order to avoid these adverse health effects. The effects of working long hours on stress levels are significant. Studies have found that long working hours are associated with an increased risk of depression, anxiety, and suicidal ideation in young employees. Chronic stress from overwork can lead to a range of health issues including diabetes and cardiovascular diseases. Furthermore, the impact of overworking on mental health can be significant, leading to low self-esteem, difficulty concentrating, and fatigue. To reduce the risk of developing health issues related to overwork, it is important to be aware of the signs and symptoms of stress-related disorders and identify strategies to combat them. This includes promoting a regular workweek of 35 to 40 hours and providing ready-to-use information sheets to help patients identify workplace stressors. Additionally, patient education about overwork-related chronic diseases can help raise awareness about the risks associated with long working hours and encourage individuals to take steps to protect their health. Identifying strategies to combat overwork-related disorders is an important step in reducing the risk of chronic health problems. To prevent and reduce overwork-related disorders, it is vital to understand the psychological and biological effects of overworking, as well as the impact of overworking on mental health, stress levels, and the immune system. Additionally, raising awareness about the link between overworking and cardiovascular diseases, as well as low socioeconomic status, is essential to reducing the number of workers suffering from such conditions. Employers can also implement strategies to limit working hours and provide adequate support to employees who may be suffering from burnout or other overworking-related issues. Additionally, providing patient education about how overworking can lead to chronic diseases is fundamental in creating a safer work environment. Raising awareness about the dangers of overworking is essential for reducing working hours, as reducing hours can help to decrease the risk of stress-related problems in the workplace. Studies have revealed that long working hours can increase the risk of cardiovascular diseases, as well as psychological and biological effects. Additionally, overworking has been linked to low socioeconomic status, chronic health conditions, and an impaired immune system. Therefore, it is vital to identify solutions to combat overwork-related disorders and raise awareness of the effects of excessive work hours. Employers should also be encouraged to recognize the signs of overwork-related diseases and create strategies to reduce working hours in order to promote a healthier workplace environment.